Good morning, everyone. I wanted to talk a little bit more specifically about some of the types of tools and resources that we can start to work together to provide to communities, some of the things that are already being developed, as well as some of the training opportunities and things that you can get involved in that are starting and happening as we speak and will be happening at least throughout 2011, 2012, and hopefully for a long time after that. But what I wanted to start with was to just give you kind of a working definition of what we call the built environment. I'm not going to read off the slide. It's essentially, for anybody that had any kind of confusion about what is that, because this is a buzzword in public health. It's something that we hear ad nauseum every day. It's essentially everything that did not come from Mother Nature, everything that we had a hand in creating, from roads all the way to schools to trees that we plant in parks that we've built. That is truly the built environment. And really where we think it's interesting is what have we done with our built environment that impacts our health? And how can we potentially start to do it better? How can we learn from some mistakes that have been made over many, many decades? Looking at the ways that we've been moving our bodies, transporting ourselves, places that we've been living, how do we start to readdress this in the future? So when we talk about the built environment, that's what we mean. It's another way of talking about planning and land use and transportation. And I think Dr. France went into sufficient detail to really talk about what our role is in community development. My background is in land use planning. I was a planner for the City of Commerce City for many years. Actually had the pleasure of working with Dan Burton at Gladding-Jackson for a little under a year before coming to the State Public Health Department. And I'm actually really excited to say that I'm not the only planner that's working in public health anymore. For a long time, that was really the case. But I would like to say that in Colorado, I think we're really starting to break that mold. And when you see what's happening in Tri-County Health Department, and you start to see land use planners that are actually doing this work, and when you see people working at, for example, the Live Well Colorado coordinators, a lot of people there that really understand land use, if they're not even necessarily classically trained, they get it. And the paradigm is really shifting in our state, and I'd like to see that happen in other places. Right now, there aren't very many planners that are really working at that level around the country. So, it's a great thing. But what do we do? What do we bring to the table? And we don't have to just come to your meetings and talk to your city councilors and your planning commissioners about what we think health is and how we think it can address the built environment issues that we have. We can give you a lot of data. We can give you a lot of resources. We could potentially give you a lot of dollars to start having those conversations on your own. But there's a lot of things that we can do to advocate and to really, change the perspective just a little bit. I think most people in the room here, these are not new, unfamiliar items that we're talking about. But what we can do is provide a fresh approach and maybe look at some new strategies for how you address it. How do you have the same conversation? And in my mind, I keep thinking about this, and when I talk to people about what I do, it's really about measuring twice and cutting once. And when we look at community development and we look at some of the impacts that we've had over many, many years, we've really been a little bit hasty in making some decisions around transportation, around land use, around how we look at parks and open space and how we look at recreation. When the money's there, we get things done. We do a really good job and we're really efficient. We work with a lot of different people really well. But sometimes we don't really think through all the different possibilities. And so if we could have this opportunity with our economic situation right now to think back about what can we do better, what can we build better, what can we plan better for the future, that's going to be money well spent and time well spent today that's going to serve us tomorrow. It's also about getting the right people to the table and teaching them about the process. And again, I don't want to be disrespectful to the people in this room. There are so many planners in this room, and transportation planners or public officials, elected officials, you sit in a lot of meetings and you hear a lot of discussion. It tends to be sometimes about the same types of issues from the same types of people that come to those meetings. How do we really kind of change that dialogue, and how do we invite other people to the table so that we're considering other options and we're considering them with a sense of objectivity? And this really gets back to that idea of health equity. We created a framework for looking at this. We call it the 7 Ps. There are a lot of frameworks out there. There's a lot of ways of thinking about this. But if you're interested and you want to know more about this particular framework, let me know. Or if you'd like to come to a training that we have later on in the year, I can explain a little bit more about it. But really, and I'm borrowing heavily from Tri-County Health Department slides, This is about how do we engage populations that don't typically come to city council meetings, that don't typically come to neighborhood outreach sessions, that don't really feel like their voices are being heard. And it happens every day. Most people, you know, I don't know about you, but working in state government now, I don't go to a lot of city council meetings. I spent a lot of time doing that when I worked in local government. But it's not really the most convenient time. Monday nights, 5:30, 6:30, 7 o'clock, yeah, I'm not going to city council meeting. And there are a lot of people around me that aren't doing the same types of things. So what are we not hearing? Who are we not hearing from? This is another population that we tend to not do a very good job of working with, and those are kids. You know, they're really the ones that are inheriting all of our good planning. How do we get them more engaged now? How do we get them to really understand what's at stake and start to get them prepared to come to the table and voice what's important to them, or to potentially be our future city council leaders and our future elected officials? It'd be great if they knew what they were talking about when they were 16. You know, how are we engaging other populations that don't necessarily understand all these new things that are flying around, like back-end angled parking? You know, how do you get people to really test these ideas out? Because when a government starts to think about how are we going to address parking, how are we going to address, you know, all the various things that come around with land development, how are you talking to the people that are around you, and how are you really engaging people? I think that that's kind of the core of one of the things that we can help to address. What are some innovative ways to bring people to the table to get their opinions so that when you're discussing these complex issues, you have a variety of perspectives to consider? And I wanted to just take a shout out and talk about some of the things that we've already done in 2010 and what's coming up in 2011, which is pretty exciting, and then walk you through a couple of tools that have already been put together so that you can get a sense of what's already out there and that you can potentially utilize today if you log on and check out an email or a website address.